Welcome back, everyone. So this is our final formal session of the day. We are very excited to have some very special guest panelists with us and moderator. And so what I want to say at the beginning of this is, for those who are here, we will, at 4 o'clock Central Standard Time, for those who have wanted to share some conversations or do some reflections, that we're offering that as the final hour or session of the day, to just be able to dig in and start figuring out, like, from a community perspective, what are some options? How do we move forward? How do we make sure that we are sharing contact information? If we're really going to lean into this collective work, then how do we start sharing those resources with one another? And so I'm not expecting that to be a large conversation, but it is an open conversation for anybody who would like to participate. All right, so for those who just joined, this session is entitled Public Health, Good News, part of a larger series called Church in the Gentrifying City. My name is Justin Merrick. I serve as the Executive Director for the Center for Transforming Communities. And we are excited to have some amazing and exciting thought leaders in regards to public health. How do we start looking at the gaps that exist in our system as well? We have both local and context and people from Bay Area and from Atlanta chiming in for this conversation. First, I would love to introduce the moderator for this last session, Regina Walker, who spent over 38 years with United Way. And I'm told not the executive director, but the power behind that in terms of the allocations and where resources will go to. And I also understand that she is on the board for the local community foundation as well. So before I pass on the baton, Madam Walker, I was going to read the scripture and the description to help frame, and then I know you wanted for the guests to be able to introduce themselves as well. But very excited to enter into this space of conversation of social health determinants. All right, so in good old Memphis fashion, our scripture is, "The Spirit of the Lord is upon me, because he hath anointed me to preach the gospel to the poor. He hath sent me to heal the brokenhearted, to preach deliverance to the captives, and recovering of sight to the blind, to set at liberty them that are bruised." Luke 4:18. The world is ailing. The church is ailing. Our leadership is unhealthy. Communities are unwell. We're all sick. Disparities abound. How do we restore wellness in the urban city? The impact of COVID continues to magnify the upstream disparities that destroy beloved communities. Memphis stands on the precipice of transformation as to how we can reimagine and reframe our systems towards a just recovery from the new normal. So public health has been defined as the science and art of preventing disease, prolonging life and improving quality of the life through organized efforts and informed choices of society. Organizations, both public and private, communities, individuals, the whole gamut. This plenary desires to analyze the health of a community in context to the physical, the psychological, and social impacts of gentrification. Again, the physical, the psychological, and social impacts of gentrification. In contrast, leading health experts from ARCHI, Atlanta Regional Collaborative for Community Health Improvement, I hope I said that right, Robin, and BARHII, Bay Area Region of Health Inequities Initiative, as to how cross-sector initiatives can address social inequalities and inequities that continue to pervade the Memphis ecosystem. So we welcome Regina Walker, Robin Bussey, Connie Binkowitz, Dr. House Halter, and Melissa Jones. And I pass the baton to you, Madam Walker.
Thank you so very much. And always it would be the phone coming on as I try to do this. This kills me. And so let me kill it. It always happens. But thank you. It's a pleasure. And thank you for calling me yesterday, as a matter of fact, to see if I was available around an issue which is not my expertise. So I'm excited to learn from everybody else.
I was going to say, Regina, was that the tone of was that the sound playing when I called? Dun, 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 dun. You're on mute. Regina, you're muted. Hello?
I hate to tell you all that, but I hate technology with all of my heart. I hate to say it, but thank you so much. And I feel like a very young woman, to be honest with you. Well, there's some others about my age anyway. And so to just learn from all of you all, because we do have a challenge, you know, with us, but we also have the opportunity to innovate. And how do we support health as it is? And right now we're running past it and we're running towards it, but we want to be where we want to be as it relates to health. So the next session will be about look at the outcomes that we have achieved. But I'm not the expert, but again, I just want each one of the participants, all of the panelists to introduce themselves, and you can do it in any way that you like, and you can tell us some remarkable things that you have been learning, and also the remarkable things that you know we're going to be achieving as we move forward. So I'm going to call on Melissa Jones, and why don't you tell us your story?
Yes, well, good morning. I'm Melissa Jones. I'm the executive director of BARHII in the San Francisco Bay Area. We are the governmental public health department of the 9-county Bay Area. So that includes the wine country, which some of you are seeing in the news now. We've had a series of fires over the last 3 weeks that have had national attention. It goes down through the Silicon Valley, where the tech industry is, and then over here to where I am in Oakland, and across the bay into San Francisco. And we are a coalition that was founded by 4 sitting public health directors who were doing at the time what I think a lot of people were doing, which were taking stock of why they went into public health, looking at the differences in life expectancy we see in the Bay Area, seeing the deep inequity by race and by class that it reflects, and really thinking about what it would take for public health to do its highest and best work. So to create the most health for the most people, with a particular attention to those who had been locked out of health. And they had what began as just a series of conversations. And I think the way that many true change conversations happen in communities, where they had some dinners, they had some lunches, they decided to invite in a couple more people to talk to them about what they'd seen, and they really reflected on the course of their careers. And started to talk about the movements that they grew up in, and the way that those movements really understood us as whole people, right? As having needs around housing, around family, around connection, around economy, that weren't divided and siloed by funding streams in the way they had been by the time they were doing the work as public health directors several decades later. And they really started to dig into when were the moments where we were at the highest pinnacle for health, right? Where we were in a place where differences in burden for life expectancy or for maternal and child health were on the upswing, and what was different about those moments. And so what we know in public health, which is different than I think many people think about when they think about health, is that so much of it is determined not in the doctor's office, but in the set of circumstances in our lives, right? There's this huge component that is about the hope and sense of agency we feel, the way that that removes stress from our lives, especially when we're in the throes of racism. And then also there are these huge pieces about health that are about the way systems get set up around us. So some of the biggest leaps in life expectancy we've seen as a country have come in moments of things like mass improvements in clean water, mass improvements in sanitation, mass immunization that jumped our life expectancy, both for children and for adults. And so they started to think about what this particular moment was that was contributing to the life expectancy differences we were still seeing in the Bay, and really came to the same thing that the World Health Organization came to slightly thereafter, which is this idea that the social determinants of health and the public health crisis of our day is deep inequality. And they created a framework called the BARHII framework that is now the framework that every public health department in the Bay Area uses in their strategic plan. It's the adopted framework of the California Department of Public Health, Office of Health Equity. And you see it all over the place at NACCHO and other places that really prioritizes the living conditions that impact health as the way in the 21st century to make change on health. And so we as their coalition have been supporting public health departments and community partners to address these interlocking needs for health. And I think this moment, more than any other we've had, shows us just how important that is. I think COVID-19 has shown us there's incredible importance in what we would call the service, the ability to get services for health, and that it's dramatically impacted by the access we have to issues of housing and economy. And so particularly here in the Bay Area, we have dramatic differences in COVID-19 infection rates. Those differences appear to be driven by two things, and two things that we were able to address as a region because of the kinds of coalitions that were put together. One of them is that the primary protection that went in place first to protect people from COVID-19 was to shelter at home. 30% of the Bay Area workforce is essential workers, continue to go to work during shelter at home. The majority of that workforce is Black and brown. And that really tracks to what we've seen in our COVID-19 disparity rates. The other thing that's true is that the Bay Area before COVID was extremely expensive. And that meant that people were in housing that was crowded, and that they were in housing where any loss of income, that month where you have less hours, really puts you in jeopardy for your housing. And so what it meant was that for people who were sick, there was a financial risk around staying home unless there was a way to really be sure that their housing could be secure. And so there are three things we did pretty immediately as a coalition in the Bay Area to work on those things. We first set a goal and worked in community coalitions to have 100% coverage of eviction moratoriums so no one went homeless during COVID-19. We hit 100% coverage for eviction moratoriums in the Bay Area, which means no one was getting put out of housing during COVID-19. That was a first and important step. A second and important step was to make sure that people who got sick could afford to stay home. And so we worked both on actions at the state level and actions locally to be able to make sure that everyone had 2 weeks paid sick leave in order to be able to stay home as they were sick. And then we did a third thing, which was knowing that in our area, the economy had gone like this in terms of wages for the lowest income workers, was to provide and find ways for direct cash assistance, which we advocated for on both the state and local levels. And we've got two different kinds of cash assistance that are operating here in California. We think we were able to respond that quickly because we had a lot of energy that had been built around building coalition together to run these kinds of projects. So all of the ideas we put forward had been piloted in some way in some other kind of either epidemic or response to a community need. And we knew about those pilots because of the work we've been doing together. And then each of the ideas we'd been able to share and provide information about, including testimony, op-eds, media placements, the writing of materials. We regularly publish briefs with the Federal Reserve and other partners to really make the health case. So that when we were talking about health, people understood the full scope of what it would take to create health in this moment. So I'll stop there to just share a little bit about what we've been doing in the Bay Area, and I'm happy to talk more about any of our work, but there's really great stuff I know happening in Atlanta that I'm sure Robin is
Yes, thank you so much, Melissa. And I'm asking you this, but I will ask everyone else that's going to give their presentation about if you gave a score or grade for all the work that you've done and how you did it, have something in mind before we end this, what you would give yourself as a community, about the successes of your work. Thank you so much. Let's see, Robin. I've been hearing quite a bit about Atlanta as well.
Oh my goodness, the pressure.
Didn't want to put any pressure on you. Just didn't do it.
Well, thank you, everyone. I'm glad to join you. Our executive director, Catherine Lawler, could not be here, so I'm very glad to be here with all of you today. So again, my name is Robin Bussey, and I am the community health strategist with ARCHI, the Atlanta Regional Collaborative for Health Improvement, which is why we say ARCHI. And we are just that. We are a collaborative of various organizations from multiple sectors who have come together and really stuck together since 2012. And we came together around, the requirements of the Affordable Care Act that required all nonprofit hospitals to do community health needs assessments and then health implementation plans. And we wanted to do that in a way that was collective, using the collective impact model, understanding that, there's really no need with everything going on and us serving much of the same population to do multiple assessments. Why not be, that collaborative and do it together? So that took some time. That did not happen at first, but it took some time. And while we were doing that, we were really looking at the spending, and I should say we really operate in Fulton and DeKalb counties, so the two most populous counties in the state. So it encompasses the city of Atlanta and a little bit of the metro area. And so we were looking at the time that we were spending about 11 billion or plus in healthcare. And we were continuing to see massive inequities, much like the income inequality that people often hear about in Atlanta. The trend was also true for health and all those things that cause health. So just like Melissa said, much of what happens or much of what influences health is not actually healthcare. It's all the things that we think about. It's our lives, what we eat, where we live, can our children read, can they go to school safely, all of these things. So we really wanted to take that approach in our work. We wanted to really bring people together that were not just from the health system, but people in education, in housing, in business, and get them to understand that we have a shared vision, we have a shared goal of really a real health and wellness in the Atlanta area. And so that's really kind of been the basis for our work. And we really work very collaboratively. We are kind of like a safe space. So we understand these are very much competing systems. They all have some commonalities, but at the end of the day, they're competing systems. So there needs to be a neutral convener where they can come, hash things out, start to do things together in a way that's safe for them. And so that's what we really try to be. And we also want to be innovative. So really thinking about those things that, particularly I also want to say we want to make sure the community is a part of that as much as the systems. So it's really critical to understand that any system, any transformation we want to see here in Atlanta cannot happen outside of the community. That has to be a part of it. So bringing all of those sectors together is really critical for us. And we really want people to think differently about how they invest and how they align together. So they're not just kind of doing one-off initiatives and programs. They're really doing some comprehensive work and really doing long-term work. Because again, we're here for systems transformation. So not just, doing some programming for 3 to 5 years, there's nothing wrong with that, but to really see that needle move, we're gonna have to be in it for the long term. So ARCHI has a 28-year plan to work together to see health and wellness improve in Fulton and DeKalb counties. And eventually we do kind of go outside those geographic boundaries, but that's really where we concentrate. And so some of the work that we've been doing has really been getting people to understand how those systems connect, that you can't really be in isolation. Your health is connected to everything that goes on. And likewise, if you're a housing provider, you're also a health provider. If you're an education provider, you're also a health provider. So really making those connections for folks and getting them to work together. And so COVID-19 really presented the ideal opportunity to test that. So it really, again, as I've heard someone say it earlier today, it ripped the Band-Aid off everything that we knew in this work. We knew those inequities existed, but COVID-19 really put a spotlight on it in a way that I felt you could no longer deny. So understanding that this is affecting us all, how do we all kind of work together to make sure that, the work that we do, that we get it to the people who need it immediately, and we do it in a really cohesive way. So a lot of our work has been focused around the concept of invert the burden, where when people are in need of services like utility assistance, like healthcare, like technology for their children, they don't have to call a series of numbers by themselves to try to go to 10 different places to get those resources. There's someone there or some entity there who can do that for them, who can make those calls, who can follow up with the systems to make sure that people get what they need in a really cohesive manner. So we've taken that approach to our COVID work. We have really had our sectors working together, particularly our philanthropic sector, helping them to understand we need you here, here, and here. We don't need you kind of looking all over the place. And they look to us too. Where should we go? What should we do? So we really try to make sure we're that guide for them as well. So yeah, just kind of getting our sectors to work together to really deliver their services in the best way they know how, but doing it in a very collaborative way, and really just kind of holding that space for them to do that work, but also injecting that that sense of equity. So while you're doing this, also consider these populations. It's not necessarily going to look like this particular population. So really kind of being that agitator or disruptor, I think is how I like to put it, to business as usual. And we also are bringing people together to say, okay, while we're in this work and when we get past it, whatever that looks like, then this is the opportunity to do things differently. Let's not just use COVID as our flashpoint to do these things right now. Let's continue to work this way so we can continue to see that health improvement that we hope to see. So I will stop there.
Well, you are an instigator as well, huh?
Yes.
You left that word out. It's all for the good. Thank you so much. And I do want to say, once everybody give their presentation, I would love for us to engage collectively in a conversation, because I'm quite sure there's innovation within all of the institutions and how we can share collectively. And again, thank you, Robin. And so let's get somebody from Memphis. Connie?
All right. Hi, I'm Connie Binkowitz. Hello, Regina. We go back many, many years. We've known each other since when I was still working at Housing and Community Development some 30-something years ago. I was hoping you were going to call on Miss Haushalter over there, but mine is going to be slightly different, if only because I don't represent an organization that is involved in the work in Memphis, other than the fact that, of course, that I tend to be involved with other very different organizations in many different ways. So what I would like to do then in this context is basically to give sort of an overview of the arc of my own career in public health, because I think that at some level, while we talk about organizations and what they do, there is an important facet to what we as participants in this conversation, in this work, are about. So the thing that I think is unique about what I bring to the table is that I am an urban planner by training. Okay, so all of this conversation about the built environment and the context in which we live our lives and work and everything else, and the importance of economy and the play between economy and health and all of that, I understand that because I am trained as an urban planner, and the policy implications and the work and all the unintended consequences of good and bad policy, we kind of like learned that. More importantly for me, though, was that the trajectory of my career started out working in the Department of Housing and Community Development, which is where I met the likes of Regina, right? And in that particular context, I got to see the work that the community leaders did relative to housing and community development. But I also was very, very clear-eyed about what I saw were the misgivings and the shortcomings of some of the work that we did, where we were not able to advance what we hoped to advance. Luckily for me, I actually ended up leaving there and going to economic development, where I became a member of the team in Memphis and Shelby County that was responsible for recruiting companies to locate and expand in the city with a very, very important tool called the payment in lieu of tax incentives. And Fitz, I heard you, okay? So that's the Industrial Development Board, and we were responsible for recruiting companies and looking at all the different incentives and investments and support that we could give to companies that came to Memphis, on the assumption that they were going to be very, very much a party to and partners in economic development. I worked there for many, many years. I thought it was a very good job of participating in the work, and that's where I actually learned what it means to work as a member of a team with a focus on, you know, on a particular set of goals, but also very, very much keenly aware of where I had misgivings about certain things that we did. So after many years, I actually decided that, I kind of like remembered that the roots of public health and urban planning were intertwined, and began to think about, you know, there's got to be more to urban planning than this, but also realized that in a very, very, you know, objective way, the sort of missteps that we as a community had relative to planning our city. So in so many ways, the economic growth that Memphis experienced by the success of recruiting companies to Memphis actually was very, very much instrumental in the sprawl that we are now experiencing and all the negative impacts of that particular pattern of development. And all the other sort of, you know, factors that come in as an interplay on where things get, where investments are put in. So I left economic development and found myself as the manager for the community development section of what was then the Memphis and Shelby County Health Department. And I really actually I actually used my being an urban planner as the thing to get me there, because I was already very much reading about social determinants of health. And then again, remembering the historic interplay between public health and urban planning. I was there for two years, a little over 2 years and a half, at which point I was also very, very much involved in pushing conversation and changing of certain language, and frameworks in the health department, because it tended to be that we tended to think in terms of community health improvement more as of education. As an urban planner, I thought differently. And coincidentally, we just happened to be at the point where California media and PBS and all those other public, very, very progressive public health organizations in the country were pushing what was then coming out of healthy communities, of course, and WHO for social determinants of health. And that was the documentary, Unnatural Causes is Unequal Equality Making Us Sick. So at that point in time, I was really very, very, very excited about the idea of using that framework and using what was then the Shelby County Regional Health Council as the body to advance this idea of addressing social determinants of health, to do community health improvement. We actually even got to the point where we thought about the idea of choosing a few neighborhoods as a place by which we could engage in the dialogue and to just really changing the way that we do things. Unfortunately for me, the grant that underwrote my work got pulled by the Department of Health for the state of Tennessee, and that sort of fell apart. But I found myself in another organization, which is the Healthy Memphis Common Table, which also started out over a conversation around a table, and it was an organization funded by the Robert Wood Johnson Foundation, but and did continue some work over there as well, relative to the neighborhoods, and then reconnected with my alma mater, the Department of City and Regional Planning at the University of Memphis, and got very, very much involved with the project in South Memphis, which was to me the inflection point in my work in public health, because I was then pounding the pavement. I was in the community. I was a member of the founding committee for the South Memphis Farmers Market. We were there on Thursday. I mean, just this experiential, it was the experience of really doing the work, they're in the heat, knocking on people's doors, helping community members advocate for why their plan should be adopted by city council despite a moratorium and adoption of neighborhood plans. So that was an opportunity for me to really get myself grounded in the work. Left the Healthy Memphis Common Table and found myself working for the YMCA at the time when the YMCA, also funded by the Robert Wood Johnson Foundation, was pushing the idea of healthy communities and doing work in diabetes and blood pressure and all of that around work that was grounded in social determinants of health. And as luck would have it, grant ends, and I find myself yet again unemployed, but this time I decided I was just going to go over to healthcare and find myself becoming a technician. And I work in the hospital. I work in the logistics side of the hospital. But I wasn't about to go and stop there. Because of a friendship with Justin and all the other folks who are in the community development world, I am now, participating in the upliftment of North Memphis Spruce Park. And in that space, I am able to coach for the environmental equity work group. And in that particular capacity, I bring all the different skill sets that I have learned through this arc, of my career, to really get, again, conversations going that are meaningful, that are important to the community residents, and finding a way to traverse this concrete work at the community level and the policy work that tends to be something that escapes, community members, not because they are incapable of engaging in that conversation, but because sometimes the reality of their lives is such that is not quite the space that they are going to be most effective in. So as for me, my hope is that I can contribute to this conversation from the point of view of somebody who has worked in various governmental institutions that are party to this particular work, but also with the hope of sharing with you what public health has done for me. And I will end by saying that I read somewhere that if you thought public health is that you were going to change public health, be prepared, public health is going to change you. So thank you very much.
Thank you. I'm just going to remind you of a phrase that Phyllis Betts said about Memphis. Memphis is embarrassingly rich with opportunities. And so what I'm hearing right now with your stories is that all of our cities are embarrassingly rich with opportunities. So thank you so much. So Alyssa, can you share? Alyssa, I'm calling you up. You on mute. Thank you.
Trying to get to the unmute button. Good afternoon, everyone. Elisa Haushalter, and I have the pleasure of serving as the Director of Health for Shelby County. And I'm glad I had the opportunity to hear everyone else first. So I think I'll tell you a little bit about myself so you know what I bring to the conversation. A little bit about Shelby County Health Department, some of the things that Connie mentioned, but where we are now and where I hope we will go in the near future, and then I'll talk specifically about COVID. So I do have probably a little bit of a Southern twang to those of you who are on the West Coast or somewhere else, but I'm actually from Pittsburgh, Pennsylvania. And that's a critical piece because I grew up in the inner city of Pittsburgh. I'm a little bit older on this group, so I grew up really during the time of the Kennedy and Johnson administration. So I will say this is the outcome of the investment in inner city communities in the 60s. There wasn't a lot of research and evaluation done on those efforts, but I know fundamentally for the investment in our community, it impacted not only my career choice, but really how I've continued in my career over time. So I fundamentally believe by investment in communities and partnership with community, we can make a difference for individuals and families. So that's the principle I come to work with every day. I spent over 30 years in public health practice in Nashville. So for DeKalb County, where the MAP model was being developed and the discussion of FAB and all those other things, I had an opportunity to be involved in those processes and be part of the work group and implement that body of work in Nashville. And within that was a significant focus around equity, improving our ability to do dialogue and to build coalitions and work with community. Fast forward, I retired, went to the private sector for a short period of time post ACA, but then was recruited to Memphis Shelby County to serve as the director. And really it was a pivotal time because of transition. So Connie mentioned earlier, it was the Memphis and Shelby County Health Department. And literally in a very short period of time, Memphis decided to no longer fund the health department. And there was a significant loss of funds about 12 years ago. And the impact of that was a lot of the great work that was moving forward that Connie mentioned wasn't funded. And everything was kind of lumped in these categorical grants. And so everything became, in my opinion, focused on the projects, fulfilling grant obligations, and this loss of a lot of work that had been put in to really focus on equity, systemic racism, community development here in Shelby County. So the charge to me when I was brought on board was to help us move into the future as a health department. So I've been here almost 5 years. One of the key things we have focused on is to try to have local investment in the health department so that we can begin or re-begin work and sustain that over time. And that's going to be a critical piece for us, is how do we engage in this work, but continue to engage in it for the long haul, not just for a year or two. And I know Robin mentioned that these 3 to 5 year projects that don't really have that impact that we want because they're not sustained. So we really have been trying to build our own infrastructure, build our staff capacity, and build sentiment around dealing with social determinants of health. Recently, Jeffrey Brenner wrote an article on moral determinants, and I really have liked that terminology. We know what social determinants are. We now are at a place we have to morally step up to commit what's necessary to affect change. So that's where we are as a health department. I'm really honored to be on the Zoom this afternoon with so many people. I'm very familiar with the work in the Bay Area, spent a lot of time at the Prevention Institute. So really I'm honored to be here, and hopefully we'll learn and see how we can really accelerate change here in Memphis and Shelby County. And then I want to just end a little bit on our COVID work. Like all of you have said, we have had a pandemic within the pandemic. We know communities of color have been significantly impacted, but I am very proud of the work that we've done locally around COVID. We do have a joint task force, so not only do we have Memphis within Shelby County, but we have 6 other municipalities. Connie referenced the sprawl, so those outer municipalities may not relate to Memphis. And so trying to bring everyone together can be a challenge, but we've done that, and we have put some things in place that I think have benefited the community. We did do a local moratorium on evictions. We were able to work with Memphis Light, Gas, and Water to make sure that utilities weren't turned off. The mayor and both the mayor of the city and the county have invested significant amounts of their CARES Act dollars to offer financial support, particularly not just for individuals, but also for small business owners, and particularly barber, beauty shops, and not just the business owner, but those who may be renting a chair, and then those in the restaurant industry as well, because they had significant job loss as a result. So very proud of that work. We did talk about financial compensation and whether or not we could use local funds to be able to provide that 2 weeks of paid leave. That hasn't happened, but we recognize that's an area to still focus. And we've clearly had rental assistance and food assistance available. And then just this weekend, which I think is beneficial, is we are actually offering enablers to people who get tested so that they're able to stay home until that test result comes back. So if someone gets tested and they need assistance, they'll get $125 that allows them to use that money for food or whatever while they're pending their result. And then the other really positive outcome, and this was led by Commissioner Tammy Sawyer, but clearly she asked me to speak as a public health professional, is that we did pass a resolution saying that racism is a pandemic. And for those of you in progressive communities, that may seem like something not very progressive, but that was a substantial statement here in Shelby County. And Memphis then followed as well. So that does at least create the political will for us to do things collectively in a different way. So I'll pause there. I'm looking forward to the conversation. Thank you, Regina.
Thank you so much. One other person, is she here? Wendy Thomas, is she here?
Wendy was she's not here.
Oh, okay.
Yep.
One of the questions as we open it up for the entire dialogue, and I say this because of some of the dialogue that I did listen to before this session happened. And so we as professionals, we have our language that we use consistently, in our networks. So how is that language, how does that language be interpreted for those families that are in under-resourced neighborhoods. So how do we translate that? Does anybody want to share that? How you make it, this is a us journey, and it's not just my journey and your journey. Does anybody want to speak to that?
I'll start. So I would say, personally, relying on your lived experience. We always like to work with people with lived experience in anything that we do. And just remember that we're also a part of the communities as well. So we have to think about, maybe take our public health or our professional hats off, and then, be a resident. Because I like to say, initially COVID was called the great equalizer, right? Which we know it's not. We definitely know it's not, but we've all been affected in some way. So really thinking about how you've been affected, how you would like someone to talk to you, what you would need from public health, and then being able to translate that. And I think also, I mean, I don't feel like I can say it enough, just relying on the community to say, what do you want? What do you need to hear? How can I help you? How can we work together versus how can I help you? So really having that open dialogue and listening and being as responsive as possible, I think is critical.
And I think the thing I would add to that, I agree with all those comments, is really being sensitive to language and paying attention to what you say at all times, but also, if need be, asking for feedback from others around your use of language, and then listening, which was already noted, but really listening to language that's used by others. I do think if we're going to create a community of we have to, one, view ourselves as part of that community, and use the language that's consistent with we and us, not us and them. And that's easier said than done sometimes. And then just to add on to the other comment that Robin made, I really encourage people as much as possible to live in the communities they serve. And people don't always want to do that, but if you're going to serve a community, you have to be present in it, whether you live there, shop there, go to church there, but it does help you better understand the lived experience of others.
Great. And also, is there opportunities for advisory councils of residents from different communities?
Yeah, that's been an important part of our COVID response. So we have what we heard very early from the health departments that COVID was likely to not be one incident, but something that would be ebbing and flowing over time. And so we decided, rather than talk about COVID response, we actually talk about it as rapid response and rolling recovery. And so we put together a team of people who had been most impacted by COVID. The communities we knew were having higher test rates. The communities we knew had reasons to fear testing. And we brought them together into a work group. And so we did that through both our personal networks. A lot of us live, work, grew up in the communities, and then also through their networks, we did a sort of funnel that goes out. And that core team meets every 6 weeks and tells us what they're hearing from people. And we use that to do everything from our communications work to naming as a region in a report card how we think we're doing. And there were some things we feel like we were doing well at that we've moved back on, not because we changed what we were doing, but because the circumstances made some items more important than they had been before. And we just take that as not for better or worse, but what it is right now and what we need to work on.
Yeah. Does anybody else want to share?
So Regina, like I said, with me, my responses is now framed around my own experiences with working very closely with community members, even if it means, cleaning up an old fish market to make it into the, South Memphis Farmers Market. One of the things that I learned is in the translation. Yes, we could all talk about this great frameworks developed by World Health Organization. And part of the challenge for us is how to make that vernacular, right?
Yeah.
And how to translate that in ways when we start talking about policies and the like, to even get to the point where we can we can be granular enough to say these are the implications of this particular kind of policy to your life, and engage in the conversation where we're able to, I think, in some ways also get to see the intended as well as the unintended consequences of the things that we're doing. So let me share a very, very concrete example. We were talking the other day with my co-chairs for Spark, and we were talking about blight. And one of the things that they said is, we have to be thinking about the kinds of things where, because somebody said, well, there are laws on the books that we just need to enforce. And we're going like, okay, let's take that particular law that says you are not to park your car on grass. And if you called somebody on that and called, the authorities, you have now criminalized in some ways the fact that somebody parked on the grass and either they didn't know it or they had no other place to park. So these kinds of things, when we're having conversation at the community level, we have to really be willing enough to push the conversation enough to make it real, not only for them, but for us also who are attempting to advance a policy or things of that sort. Mm-hmm.
Yeah, their voice, which I completely believe in. My 38 years with United Way started in Virginia and then eventually here. And I retired in 2014. And so what I have to say, and I want to just share this about me in Memphis. I've had a lot of faith in Memphis, and it's because of the history that I continuously learn about Memphis and about the great things in Memphis, in addition to the challenges still. So what do you all think you all are in your cities, for the most part, Memphians as well, as it relates? Do you feel that movement actually happening in a very aligned movement that brings everybody to the table? Or is it still a struggle for us to tell our truth and what our experience has been as folks of different ethnicities? Anybody would like to speak to that? Melissa, how about you?
Well, I'm in Oakland, and so we have a history of movement, and it's a strong one. And there are the movements that people think about, and there are this whole new set of movements for whole new communities. So sometimes you'll hear me talk about communities in multi-layers. It's because the Bay has so many different communities, and so I think it's important, the distinctions. I think that we need a really strong agenda that connects us across race, and so that's why our core team connects across race, and it specifically includes the Pacific Islander community, which is usually bulked in with the Asian community, but actually has a really different set of needs and actions. The African American community, and we've got sort of different parts of the Black community here, particularly in Oakland, and we've got a way that we're moving to different parts of the Bay Area, and we have some distinctions that are really important between us. And then the Latinx community, which out here is both an established Latino community and newer indigenous immigrants, particularly from Mexico and Central America. And that's a very different set of partners. And then we have of course, the largest urban Native American community. And so, so we have a lot of different communities. And so I think that's a really important thing that we've focused on and seen. And I think, 20 years ago, I was in a series of very early conversations about Black-Brown unity for California and what that could mean for us in terms of our policy and strategies. And I still continue to believe that that's a really important part of our work. And I think we're in a really interesting moment to figure out when we need strategies that are Black-centric and when we need strategies that are multi-community. And I think that's the conversation that we're in right now, and in a lot of our small group conversations. I don't know if that's what you mean, but that's how I think about where this moment has taken us from then to now.
Well, I want to share something else too. When I was growing up, we grew our own food. And then even for the meat that we needed, there were cows and there were pigs. And the only thing we went to the store for was some sugar, some salt, just the basics. do you think we should be promoting more in our communities about growing some of your food? You know, because you know, the art of doing that just ran away, but then you have still some people doing it in their backyards. But do you think there's an opportunity for our cities to just start pushing that a little bit more? Because that's a real quality about good health, to be honest with you, that you raise yourself. And then to me, it also gives you faith in yourself because you're able to do it and you're not relying on anybody else to do it. And then keep those seeds, put it on out there, you know, from winter to whenever. So have your cities been doing that, promoting that? Because there are several ways to ensure health.
Yeah, we've seen a couple of things here. I don't know, Robin, if you want to. So we have definitely community gardens, which have both people learning from each other how to grow and community building that happens. And then we have some programs that really help people grow at home. And for us, in a lot of our core cities, it's important that that's raised beds. There's, you know, soil and other issues that we have to think about here. And so there's some work around making sure that's safe for folks. And then we have this other piece, which is we are really close to a lot of small farmers in California. People don't think of the Bay that way, but we are. And so we have partnerships with schools where schools actually have these like special cards and things they give kids about these vegetables that they get in boxes, the CSA vegetables. And so they bring them into schools that are having, particularly schools where we know food insecurity is high. And so there's purchasing from the farmers, which creates that revenue source for the farmers. And then the farmers bring food in and the kids learn about different vegetables and other things that I think are helpful. They do cooking classes. So we have kind of a range.
Yeah. Alyssa.
Yeah, I actually was just going to comment on what you said earlier. Yes, I fundamentally believe we should be promoting it and being creative, particularly with farm to school or connecting with local farmers. I think your comments really about generativity, and when people grow their own things, they develop a sense of confidence, and it is a creative process as well. So I think it has many positive impacts that's way beyond the actual access to healthy food options. And then also the interconnectedness between community members and different generations within the community. So we need to be doing more of that here in Shelby County. There's some happening, but I think we can do much more and look at some other communities that have been doing it now for quite some time. So again, it's how do we sustain it moving forward and not just do it for a short period of time.
Yes.
And just to add on to a little bit of what Alyssa just said, this is Pedro Velasquez with LifeDoc. Doria on the call and Justin on the call are aware of it, but the summit, we're hosting a summit on Food System Summit here in 3 weeks on the 22nd. And a lot of it is built on the concept of the impact of the food system on the health system and how there has to be a collaborative effort, an intentional and collaborative effort to stop working in silos and start coordinating and resources and programs. And some of that is around urban farming concepts on a lot of this vacant lots and blighted properties and how it can be used to produce things that can be distributed in those communities through various programs or through various things that would add labor or opportunities or work opportunities. And it's a lot of coordination, but in Memphis, it's pretty interesting to see how many people are already working on it and would like to intentionally work together on solving some of these food issues that are affecting communities of various races. In Memphis, a lot of the Hispanic communities are the same ones as the African American ones. And some of the cultural and socioeconomic barriers that we'd be addressing with some of these solutions are oriented to those areas, I guess.
Great. If you all had the opportunity to raise the magic wand, and there's only one thing that you want and you can get, what would that be as it relates to health? It could be individual or it could be institutional. So that one thing, what would that be?
Could you repeat the question?
Yes, if you could just wave that magic wand, and right now mine is a pencil, and something that one thing, if you had it, that would just push everything to the way that we want it as it relates to health, as it relates to equity, and all things that are impacting our communities, what would that be? That one thing. If it just fell into your lap one day and it was one of those ahas, this is it, what would it be for you?
So I would say it, this is not a tangible thing, but it can be. So it's one huge thing, and it's equity, quite frankly. If we had equity, true equity, you know, racial equity, social equity, health equity, I think we all know that would be the magic pill. But we got to get there. So I like the magic wand scenario, but you know, I'm also thinking people need, you know, universal income, and you know, we need Medicare for all. So I just grouped it all to equity because there's so many things under there. It's just so hard to choose one. But equity with the big E, I think, is what I would like to see.
I like that. That's great. Equity with the big E.
Okay.
Yes, that's a t-shirt. Go ahead and get it done. Equity with the big E. Anybody else like to share?
I'm going to add to that. It's, again, not as tangible, but I think it's a statement I've had to say a lot during COVID is if we could prioritize people over profit, I think we will make big strides towards a better future for all.
Yeah, I think those are both really powerful. You know, I've been thinking about what can power our movement long term, because we have things that happen, and then there's ways that it falls back, and then it has to be repowered. And I think about community development corporations and how the Community Reinvestment Act was formed, and it created this long-term durable funding stream. That means we have community development corporations all over this country creating affordable housing.
Wow.
And then I think about federally qualified health centers and how they have these durable funding streams that mean millions of people across our country have access to primary health care. And I think we haven't done that for the differences that we see in life expectancy. And so I would love to see a durable, long-lasting, significant funding stream that's focused on driving down disparities and creating opportunity for people through the social determinants in a way that we can do it neighborhood by neighborhood. And you can count on the resource. And so like when Connie was saying that grant ended or this grant ended, that we have this way that we know we're gonna power energy over time into equity.
Wow. Justin, do you want to share? Is he still there? Justin.
Yep, I can lean in. I was taking notes from everyone. I been thinking a lot about this, and I have to say that both Robin and Catherine's work from Atlanta and Melissa's work from the Bay Area have been inspiring. So we're part of a larger network called Spark that Connie spoke to earlier. So in a localized way, Connie helps to support the environmental equity and health equity in terms of how those things overlap. And we also dive in from CTC's perspective to cultural equity and economic equity. So those are the four kind of parts, which really are social health determinants, each one of those, right? Education would be the fifth main one. And so, I mean, recent conversations with Dr. Haushalter, like as to how, like, hey, where are the gaps in our current system? So I guess what I would offer to the conversation, why I was personally excited about this, is that CTC's infrastructure has grown, you know, tremendously. At last year we were 5 and now we're 25, where about 10 of those are organizers, right? And then some are consultants, and the rest are like the backbone support. And what we would like to toss out, right, is that we come from a faith-based, beloved community, God's economy, foundation. How do we continue to expand that into systems work and understanding what equity looks like on a population level impact or population level health impact? And so we've been studying these various models. One, that I will lift up. I told Melissa at the beginning of the call that I would lift this up probably, and it's because I just think it's phenomenal. I don't know if everybody can see the screen.
There you go.
And it shows BARHII's a framework, right, as to a lot of times where health organizations, they may be nonprofit, they may be city government, but they focus on the risk behaviors, disease, and mortality rate, and that's considered downstream. But what I love about their framework is how they are moving upstream, and where that circle is, right, that's really where CTC's heart is when we talk about living conditions, right? So our physical environment, social environment, service environments, and economic environment, those are the core social health determinants in terms of conditions of our neighborhoods. And so I really appreciated somebody threw out when you were talking about keywords, sustainability, people over profit, equity, and then neighborhoods came out. What does a neighborhood strategy or a multi-neighborhood strategy look like that addresses the social and institutional inequities that continue to feed each other, and then that impact our living conditions, right? And so CTC is like, hey, how do we start organizing towards a larger multi-neighborhood strategy that allows for us to integrate this work where we have impact on policy? So we're trying to set up infrastructure to lean into this lofty vision, and ARCHI and both ARCHI and BARHII have been really critical. So thank you all for taking time in helping us start to do some strategic planning, where by January 1, we hope to really heavily lean into social health determinants and be an ally, Dr. Haushalter, to even the work that you are doing. And I didn't know that you named racism as a pandemic, because as I study websites from across this, listen, I didn't know Memphis had even gotten there yet. So I'm tremendously excited about that, because that's the foundation. Like when we talk about root cause, it ultimately does go down to race, power, and privilege, white supremacy. That's all a part of the fabric that makes up these institutional challenges that we have that doesn't allow for us to move the needle. So yeah, I'm sure I have lots to say, but to be honest with you, it's based off of the people that are speaking here on this call. And when I learned, about the work that Connie Binkowitz did for decades, right, and trying to bring these things together, it's very clear to me that Memphis's approach, or CTC's approach, to neighborhoods, where neighborhoods have everything that they already need, Memphis actually has everything that it already needs in the same way. And so I get really excited to be able to dive into this work. So that's what I would contribute. And if anybody wants a copy of this, we're looking for allies in creating what this larger table is. So we've been meeting for the past 2 months, and we have about 10 to 12 anchoring organizations that are supporting that, but we want to lift that up by the end of the year to 50. And we are in some significant conversations that we think will expedite and accelerate that. Mm-hmm. Thank you, Regina.
And I thank you all, because like I said, this has not been my lane specifically, other than being a parent. And so the more that I learn, and I will be a tattletale, what I learned, I start telling other people, this is something that we need to be supporting in this city. So it's not just about the institution of the name of the institution, it's about the work that they're doing in alignment with the families that they're serving. So this is a we process and not a us and then them. So I do appreciate your comments, and I know we're going to be going into another session. Oh, we still got some time. And so can I ask some of the other folks who are listening to this process, if you all would like to share something as well, like Colenso and Rosemary, those who are sitting here and heard some of the conversation, is there some things that you all want to share? Charles, Elizabeth? Frank,
Regina, can let me share something
please.
that I want to. So part of the thing that really is a challenge for me is if you look around, I am the only Asian face in this conversation. So one of the things that I have been challenged with is how to bring my own community into this kind of conversation as well. Because as you know, I know in some parts of the country they are there, but in this part of the world, we're not. We're isolated. I am the Asian face for my own Filipino community over here, and that's a challenge that I have, and I want to figure out ways by which we can be part of this conversation, and really largely because it really bothers me in some ways that my own community has its own biases and it doesn't seem to understand, you know, things about race and all of the things that we sort of like take for granted as what we think is privilege, but is really not. And we have blinders on. But more importantly, I think one of the things that I'd like to share is the importance of realizing that if we are to do this work, for me at least, based on my own experience, I've had to always go back to my spiritual core. That is where that's where it begins for me. And that's why I was very, very glad when the words moral determinants of health were, you know, was brought up. Because when all is said and done, though I may not have necessarily thought about it as the primary purpose for why I do the work that I do, it turns out to be that as I look at the arc of my career, that this was really part of who I am as a spiritual being. And so I think that we cannot, dismiss the fact that all of us who are here, there is a deeper call, you know, that we answer to. And it asks courage of us and perseverance. And, you know, again, you know, the earlier conversations about willing enough to be speaking truth to power, because there's going to be tremendous challenge for us as we move ahead in this work. And only when we are able to go back to that source, are we able to go on and sustain the work that's going to be asked of us.
Yes. Yes. Thank you. Does anybody else want to share?
Olivia,
Olivia, feel free to go. But Regina, we also have a short video that we want to show everybody.
Oh, okay, great. Olivia.
I have nothing super significant to say. I just want to really show my appreciation for all of us being here. First of all, my name's Olivia. I'm with the University of Tennessee Extension. I've been in the discussions with Justin on what it would look like to kind of model something in Memphis after this BARHI and ARCHI initiatives. And when you asked like the magic wand question, I was like, I really don't know. Like, but then I think Robin said equity with a big E, and it just made me think of unity as well. And so I just appreciate this conversation too, because I feel like equity with a big E will only happen with unity in the city and nationwide even, you know, like it's really cool that we in Memphis get to lean on people in the Bay Area of Los Angeles and in Atlanta. And so, yeah, just appreciate all of you, but just want to throw out my little buzzword as well.
Thank you. Justin, take it over.
Okay. So I want to thread some dots. I want to make some announcements, and then I want to transition us into the final session, which this was really just, we said 8 to 5, but this last session, if you choose to stay on, really is for those who are passionate, and especially coming from a more neighborhood-centered approach, or if you want specific information, or if you have specific questions from throughout the day, that a few of us are staying behind to engage those conversations. So I'll start off with that. I also want to announce that I know this is a partnership with the Episcopal Urban Caucus, which is a national cohort that accompanies the Episcopal Church at large in helping to support what it means, right, to lean into some of these equitable practices that we're discussing. And they said that resolutions at the end of the day need to be sent to BK Larson 1809 at comcast.net. Again, that's any resolutions from any of the members to send to BK Larson 1809 at comcast.net. We also want to offer a very special thank you and gratitude to Bishop Phoebe of the West Tennessee Diocese that really was instrumental and pivotal in getting this off the ground. And that this also becomes the start of a much larger conversation between clergy, between non-clergy, between lay, between residents outside of the church, right? We want to be able to position ourselves to be a convening space for these conversations and understanding the unity piece that Olivia just mentioned, the big equity piece. Dr. Haushalter, you referenced people over profit. I mean, if we can really start leaning into these practices, the sustainability will come. And so how I would link that back to a former conversation in the last session, kingdom versus kingdom. Reverend Jackson just brought up, so some of us are here in this larger space at the hotel as well, and sending dialogue to one another and sparking the movement internally, right? But what she mentioned was, last night, a question came up, can kingdom evolve into kingdom? So I proposed that. I got a few responses. One was no, that the foundation would not allow. And then I challenged that, right? I'm asking that to everybody though. Can kingdom evolve into kingdom? And so one of the narratives that just came up in some of our sidebar conversations was, you know what? We cannot say that we're always going to be the right thing, but we can do the right thing. And then hope that that leads into us becoming the right thing. And then somebody else brought up, but you know what? For us to do the right thing, we have to be the right thing as well. And so it's this egg, you know, the chicken and egg, I think, syndrome, and it's the same thing in terms of, listen, for us to lift this work into God's economy, it starts from a space of relationship and developing that. And I am honored that CTC is able to help cultivate that space for the city of Memphis. We're honored that the Episcopal Urban Caucus has extended a national platform, right, for us to spark a much larger conversation. And I'm honored that we have had a deep partnership alliance with the Memphis School of Servant Leadership. That is really what helped to seal the deal and really extend this into a space of authenticity. And so we have somebody mentioned, and Ms. Hazel gave a note saying that she's learning as to how to put this into Orange Mound practice. And we've had several neighborhoods to lean into this conversation. And what I'd like to leave you with is just a small fragment of what I would challenge all of us to extend our eyesight into seeing. So when I first landed at CTC as an organizer, I was encouraged to just walk the neighborhoods. And the question that Regina Walker asked about wave your magic wand was the epitome of the fundamental question that we needed to ask. Because what it does is it places people in a space of imagination. So Olivia, right, how you were like, I'm not sure, because a lot of times we don't dream and we actually don't imagine the spaces that we want to be in. But as I did that, I realized that it's much different living in a community when you're walking and not driving. And you start to notice the smaller nuances that make it so vibrant and make it special. And so this video that we have coming up is an homage done from the eyes of both Orange Mound resident and artists that were working alongside Orange Mound. And it was a 6-word poem that was asked for them to create. And so in our community meetings, we come up with different activities that allow for us to do the imagination piece. Because a lot of our learning is really unlearning the things that we've learned so that we can have open space to learn the things we need to learn. And so I think it's just a beautiful way to leave you with today. And then as the video closes out, we will lean into our 4 o'clock session for those who want to stay on. We'll leave it open for conversations to emerge. But also, please stay tuned to everything that we're doing. We're rebranding our website, www.ctcmidsouth.com. Thank you for everybody who contributed to the panelist conversations today. Thank you for everyone who contributed to these conversations and chiming in. And I'm going to extend a forward thank you, right? And that you're going to pass the story on, telling the stories of people of faith and love. The journey's now. Keep your hands to the plow. Oh, beloved, pass the story. What are the narratives from today, right, that we can take in tomorrow as we reimagine what the healing economies of today need to be? So this has been a blessing. I thank you all. Please continue to extend prayers to Memphis and the work that is happening here. It is transformative, and as Anasa said earlier in session 3, the future of America can be and can live right here in Memphis and the future decisions that we make. So thank you, and I cue our Orange Mound homage.
This is the Orange Mound Creative Underground collaboration piece. Here is our 6-word story poem. Dog walks, car rides, Zoom calls. Missing friends, visual faces, hearts together. It took COVID to slow down. COVID and illness made me stop. I find myself tired, but excited for the future. Early morning sunshine, great day vibes, loving free music shows and Zoomalations. Praying for change to come soon. And also, we are the change. Education unlocking the key to that future. I need people. We all do. I am practicing voyeurism right now, and you all are too beautiful for words. I see love and feel loved. Love will keep us together in the city of Memphis. Prosperity is in reach, today and always.
God bless everyone. We look forward to our next conversation. Thank you for tuning in, www.ctcmidsouth.org. And at 4 o'clock, in about 8 minutes, we will open the floor for whatever questions that you may have. Thank you to the Episcopal Urban Caucus, the Memphis School of Servant Leadership. In love.
To share one thing about you, one thing. When you all made your presentation to the Community Foundation, and I'm listening to the story, and then I went online. I said, let me find out about this organization. And then I saw all of your members. I said, this is a no-brainer. This is going to carry us through. So I salute you and your team and everybody that's in this journey with you, because this is the way we're supposed to be going anyway, our journey, and changing it for everybody that's a human being. So I salute you and your team and everybody that's on this journey for you. So, I feel like crying right about now, but I'm gonna hold it in. This was very inspirational.
Thank you.
in trouble or in need, and with you on my side, I know everything will be all right. Oh, I know everything will be all right. If not for you, I never could have made it. In all my trials, you pulled me through. Oh, though I've been down, I'm never forsaken. Oh, everything will be all right. Now I know everything will be all right. So you have to say this. Be all right. Be all right. Oh, everything will be all right. Come on, let me hear you say it. Encourage yourself tonight. It's gonna be all right. Everything will be all right. Say it again. Be all right. It's gonna be all right.
All right, we are back. So this is really more of an open forum for those who are still here, for those who may have stepped away, and just really wanted to open up the conversation to any feedback, thoughts that you may have had. It could be from a neighborhood-centered approach. And so I'm seeing Father Hubbard, I don't know if you were still there, but I definitely wanted to be able to call on you, but really just wanted to open. And so for those who are there to kind of come off or come back to the video, if you will, and let's open a conversation. Like what did we get from today, and what are steps forward from the neighborhood level, from national level, from just whatever feedback that you may want to lean into. What were the moments that caught you throughout any of our sessions? Father Hubbard, I don't know if I see you're back. I gave you a shout out just now, but I definitely wanted to be able to pull you into the conversation because I know you've been here for all of them, and I've seen you actually taking some notes as well. So just want to open the platform for us to dive into anything that may be still hanging for people. I see we have Elizabeth Jacobs on, Father Hubbard, Connie, Charles Lane, Ziania, Geraldine, Brooke.
Can you hear me?
Yes, I can hear you.
Okay, for those who don't know me, I'm Colenso Hubbard. I'm an Episcopal priest, and I've served in the inner city of Memphis for over 30 years, and in the Claiborne and Foot Homes public housing community. And the one thing that I thought about was, it's never too early to start working with our youth and working with people in the inner city. Many times there was 3 and 4 generations of people who have lived in public housing. And so housing ownership was not even a possibility. Can you hear me? Can you hear me?
Yes, I can now.
Oh, okay. Well, do I need to start over then?
No, you're good, Father Hubbard.
Okay, I'm just saying it's never too early to start working with our youth, because of working with people in the inner city that was 3rd and 4th generation welfare recipients living on public assistance. There was not a possibility that they could even dream of having a home of themselves. So if we start working with our young people early enough and encouraging them to get good quality education, then they can one day see the possibility of home ownership. And we know that by having a home, that it also means equity. And that equity can also become bargaining power. If you got $50,000 or $100,000 worth of equity into a home, then you can go to a bank and you can get a loan and you can start a new business. And so home ownership can lead to a business ownership and wealth for generations to come. And so I would encourage us to start with our young people in training them and educating them, because you know that many people in our society succeed on people with bad credit. So we need to teach our children the importance of having good credit and starting out on the right path, and not creating more debt than you can pay back, so that you can have a lifelong quality of life through ownership of homes and businesses.
I love that, Father Hubbard. I pull from one of the things that main points that you were saying was we need to invest in what it means to do community wealth building, and that home ownership is a tool and a lens for us to be able to do that. So along with not only with financial planning and financial education, right, and the financial capital that you're talking about that comes along with the home, but making sure that we are investing like things like property, because there's a return, because there's an increase in interest, and that we need to be passing that down intergenerationally as well to our youth. Thank you. What else? I see we have a comment here from Brooke Sarden that says, I have to be in another place right now, but wanted to say I didn't know how much I needed this community connection until it happened. Then she also says the first week of Youth Voice program, and these are, for those who don't know, Brooke Sarden serves as a youth director for CTC as well. She says, first concern the teens raised was that the worry about graduating and knowing nothing about finances or buying a home. So that's echoing exactly what you were just saying, Father Hubbard. I see an applause going up, Ziania Cruz. And I noticed, so Ziania, I didn't get to lift up, and I don't know if you caught Magali went into, I can't remember what the term was now. Manifest destiny. And she, you know, in between breaks, she mentioned, Justin, I think that you interpreted that different than what the intention was. So we revisited that, and I don't know if you caught that or not. But just in general, your commentary throughout the whole thing was spot on and impeccable. So I don't know if there's anything that you may have wanted to, you know, to lift as well.
Oh, thanks. Thanks everyone for having me here, and especially CTC. This is my first week, so I've just been doing a lot of reading. So I'm really excited to be on the team and to kind of fill out everything. And I was actually not on the call when we hopped back on because I'm looking at homes in my neighborhood to be able to be next to my family and next to my community, to be able to stay there. So I apologize for that, but you know, say good prayers for me. I put an offer in, so hope I get something. Yay! But yeah, so essentially I think everything, I got a chance to sit down earlier this week with Magali and just kind of talk about the land trust, because it really interests me, and she was kind of explaining the different things that she spoke widely on about this today. And I just think it's really exciting to hear the different people doing a lot of the different work. I asked Harry if it was okay that I was here because I'm not of Christian faith or of like so-called organized religion, but kind of because I'm a part of Native American church, which is like half traditional, where it uses like, you know, our traditional songs and peyote medicines, and like usually it's done in a teepee, but it's also like brings a lot of aspects of a colonizer's church, well, of a Christian church, pardon me, into it, because we weren't allowed to practice our, you know, our ways without like having that kind of guise. So it melded into something that it is now. So kind of that's my faith background, and I'm very involved with that, and it's really important to me. But like I'm also like unpacking now that I'm like older, like, oh wow, this was colonized too, and that's okay as long as like I know what the roots are and I'm like able to get down deeper. And so some of the things that like I'm hearing on this call are really awesome. And there's a lot of things that are triggering just because, you know, I'm second generation out of residential schools. And so like a lot of the faith-based talk makes, you know, it used to make me like get like kind of like a feeling of sick in my stomach just because it was like a lot of generational trauma and just like things that, you know, hadn't really been openly discussed. And so like when I think about manifest destiny, I was like, no, that's terrible, because it led up to like, you know, everybody getting murdered and, you know, I think worse things. And then like the land. And then I think when we talk about like people over profit, I think that's cool and it's awesome, but it's also not like, we're still like getting at the weeds and we're not getting into the roots and the seeds of it. I was looking in the binder, but it's just like, okay, so it's actually like life that's over profit, because people are not the only life. And like, if we can think of like, Magali was talking about like land ownership and like how we can't actually own land, like we have to participate in this capitalist system in order to like make our gains and make our moves and hopefully flip the script, but we can't actually work from the inside or like use the same framework that the colonizers are still using, because if we say like people first, we're still only hitting at like the top. And like the reason in my mind that like we're able to disrespect Native and Black women so deeply is because there's no concept of like the respect for the land and the respect for the water, because that's property, just like we were to a colonizer's mind. And so like the concept of owning a human or purchasing land should be so foreign to us, but it's not. And I just think it's like important for us to like look through those things. Even when we're talking about pioneering work, we're talking about, how do you call them? Terrorists. They're terrorists. So why would we want to say, oh, we're terrorizing our communities, we're pioneering our communities? No, we're not. We're talking to them. So I don't know, I just think like, even like, look, I mean, I think it gets tricky and like, there's layers that I'm going through too. Like Magali and I were talking about how it gets into like Latinx is classified as sometimes a race or an ethnicity, and that erases Blackness and indigenous people from the concepts. There's different countries that are, it's just an ethnographical group. I didn't say that word right, but you know, but I don't know. I was enjoying the conversation, and that's kind of like the lens I'm looking at it through. And I know I have a lot of more work to do and a lot of more learning to do, and I'm glad there's a good container to be able to do that work in. So thank you again.
So Justin, I really, really like what you know, Ms. Cruz has been talking about, because for me, part of the work and part of the call for this work has to do with the fact that, so I came to the United States at 23 years old. I left a country that was colonized by Spain for 350 years, by America for 50 something years, by Japan for so many years during the war, and then given by America the freedom to be a republic, ill-equipped, you know, and that it's no wonder why we are where we are, right? But it took me coming to the United States to really understand how much unpacking I need to do, you know? And it is no wonder that when I look at my own folks who are in America, they don't quite understand some of the things that I feel very strongly about, that is so, you know, so reflective of our own inability to uncolonize our mind. So when I talk about really wanting to bring this work as well, and conversations about racism, conversation about inequities to my own people, it's really because of the fact that, hello, we have a lot of unpacking and reconciliation to do. And so I find this work really very, very broad, and it calls to different people in ways that we had never been willing enough to explore, at least in this part of the country. I know that Asian Americans and Filipino Americans in particular are exploring this as well. But for it to be here in our city, it's really, really an opportunity that I think goes beyond the typical conversation around race, which tends to be about, you know, African Americans, and no disrespect to African Americans and Latinos. It tends to be rather sort of like limited and rather insular. Mm-hmm.
I will add, and I appreciate that, but I really want this to be open dialogue. But I went to a conversation at National Civil Rights Museum, and it was on race being binary, right? And that we have to understand that the constructs are much wider, you know, than that. And so I really appreciate that feedback. I mean, I will say from our perspective at the Center for Transforming Communities, we're wanting to lean, you know, into that. And so often, right, it is a box that's checked. Number one, right? When we talk about equity and we talk about that work, it absolutely is a box that when people want to say that they do the right thing, that they check that off. But there's a difference between doing the right thing and then being, you know, the right thing as well, and the embodiment that goes behind that in terms of language.
I'll be home when you get home.
In terms of languaging and lots of other things. And so I want to offer that because I don't know if there's not one pathway towards this journey, because to me, what everybody's saying is liberation. And I think there's multiple ways to be able to get there, but there is a shared value system, right, that has to happen, a shared respect and trust as we build what that beloved community is. What else? Elizabeth.
Hey, Justin.
How are you?
It's good to see you. You know, I've been listening all day and tuning in, and I've been muted because I have dogs and they have toys and they bark. But I just wanted to say on behalf of Episcopal Urban Caucus, thank you so much. This has been so enlightening. I thought we cracked the walnut last year at the assembly when you and your team came in, and it just it never ceases to amaze me how big it is. You know, living in New York City, and you know, I have to say that I myself live on the Upper West Side. If anybody knows New York City, it's prime real estate, and I sort of inherited this apartment when one of the priests retired to Florida, and he didn't want to, you know, he had to finish out his lease, so I took over his lease. But being pushed out and pushed around, and it is unbelievable. I have, you know, I retired from the Columbia University Medical Center, and they are the primary people pushing people out of this neighborhood. And I find myself, you know, going to meetings saying, listen, stand up to them. You have leases. They cannot do this to you. They cannot refuse to renew your lease. I don't care if you haven't paid your rent. They cannot refuse to renew your lease. Go to court. So you have to stand up to them. But so many people will knuckle under to a big corporation and just move on. And then we find ourselves homeless or renting rooms. And it's unbelievable. To rent a room in New York City is a minimum of $800 per month. That's to rent a room with no amenities, no access to the kitchen or the refrigerator or cable or internet, anything. And stop frowning, folks. This is New York City. And it's you know, it's becoming a way of life here. And I would like to see it stop. So I cannot overestimate the work you folks are doing in Tennessee. And I'm telling you, I got some ideas here today that I'm taking back to New York City and say, look, I know it's Memphis, but they got it going on. So thank you.
Thank you. I see we have a couple of panel sidebars as well. From Kathy Temple, I'd like to know how these processes would work in a community like Douglas that has less than 1% home ownership, no economic opportunities, and no support from the local churches who continually contribute to the current decline of the community.
And Justin, can y'all hear me?
Yes, we can.
Okay, I just want to add to that because I don't want to make it to seem to be all negative. But you all know I was born and raised in Douglas by way of a 20-year layoff and came back 20 years ago. And so I know everyone in this community generationally. And I know that I have not, and a lot of times I believe some of it has to do with who I am. The last pastor, I called every pastor in the consortium for Douglas this past week and invited them to this space. None came, nor did any express interest. The pastor that I'm closest to, Pastor Davis, who is still my grandfather's pastor, he called me, you know, baby, we family, I love you, we love each other. But this is just not his thing. That's what he told me. He's the biggest church in Douglas. How can I engage these people? I don't know if this can be addressed without looking at me as I'm still a little girl, because they changed my diapers. I got that out of two of them. Oh, I'm so proud of you, Kathy. I remember when you was a little. I don't need that. I need them to see me as an agent for this community, for bringing us up. But I am at a stalemate with the churches in my community. I haven't a clue what to do.
So in response to that, I think one thing that I would say is that churches have gatekeepers. And a lot of times the gatekeeper is not the pastor. A lot of times the gatekeepers in the church are the ones who are really responsible for the decisions being made in the church. And a lot of times they sit in a pew. And so I think that sometimes when we look at churches and we look at church leadership, we feel like the people who are in the pulpit have the most power, but really the people have the most power. And church is made of the people. And so it's really trying to identify who the gatekeepers are. And I think that, you know, even churches, we are responsible for some of the effects of gentrification happening in our communities because we are no longer parts of the community. But we have to see ourselves as an extension of the community that we are a part of, where our buildings reside, just like we started talking about anchor institutions and anchor strategies when it comes to hospitals and educational institutions. We have to do the same thing with our churches, and we have to hold them responsible and accountable to the community in which they sit. And make them know that they are serving a community and that their presence is needed in the community as much as their building is needed in the community. And even more so that their presence needs to be felt in the community. So I think it's really about identifying who the gatekeepers are. And I go back to a conversation earlier today when Pastor Norman talked about when he came into the community, he had to go and meet people at the different churches in Binghamton to really start the relationship and start to build that network so that they could work together. You know, something about our history has made our churches more competitive than they are collaborative. Thank you. Then they are collaborative. And so we have to think about how is it that we become the universal church? And what does it mean for us to serve in a capacity where we serve the neighborhoods that we are a part of? And so I really think, specifically, Kathy, to your point, like, I think it's finding who those gatekeepers are, understanding where is the connection to Douglas, to those churches, and who are the members who have those same generational connections to the community, who have the same passion and connection to what's happening in Douglas and wanting to see a change in Douglas, and then finding them and using them as a leverage point to go to the pastor and say, hey, we got to do something about our community, because it's up to us to change the communities that we're a part of. And if we sit in a building, then we have a responsibility to that community.
Drop the mic.
Yes. Thank you, Geraldine. Kathy, but I'm not worried about that. We're there. Well, we often think of church as church building, church institution. I think of church as church instigation. We also think of church as church organization, but I would like to think of it as church organism. And so often when I think about church, when I think about what church was, we've lifted more than once today, Luke chapter 4. When I think about what church was and what the gospel work is, I'm thinking about what Ziania is lifting. A throwback to trueness, to the past, to who we all are, pre-colonized movement. And so I'm not worried about Douglas because of the time is now Douglas. I'm not worried about Douglas because I think you're going to keep pounding on those doors until somebody listens. There's a example in scripture of a woman coming to an unjust judge, and she keeps on and keeps on and keeps on until the judge says, I am tired of her coming. I am going to give in to what she wants. And so keep pounding on those doors. In that scripture, we often lift that as the woman being the victim. But in that scripture for us, we lift that woman in womanist theology as the woman being God, the one that continues to seek after and seek after and seek after what is righteous, what is freedom, and what is liberating. And that unjust judge, because we never call God unjust, that unjust judge are those systems that are in place. And so I'm not worried about Douglas because Kathy is in Douglas. So keep at it, Kathy. Just keep knocking and pounding and knocking and pounding, because that judge ended up saying, I can't even sleep at night because this woman keeps bothering me. So keep at it, Kathy. You are in scripture. You are scripture in today's time.
We also have some commentary that supports, and I'll kind of round that into the conversation that you were sharing as well, Kathy, from Adam N. I heard a pastor say they would not be distracted by political concerns and would focus on the gospel. And he said, "You mean this isn't the God? You mean this ain't the gospel?" And so, what I offer, right, is that there's a lot of challenges that are happening in the neighborhoods or community, but I also think there's opportunity for. So let me say it like this: Memphis, no place is perfect. We all have our different, strengths and challenges. And so same thing, if we were to scale this conversation beyond Douglas to Memphis, right, we would be able to claim some of the same things, and we would be able to claim counter narratives to those things as well. But I believe part of the strategizing part of the shift or paradigm shift is through strategy. And so what outside forces do we allow to come together, right, to help integrate into into the Memphis space or into the Douglas space that allows for that liberation, unpacking. So I would love to lift, in light of what Florida was saying as well, stay in there, and know that there is a support system waiting to be able to help instigate, if you will, those types of conversations that allow for us to loosen up and really lean in to the real work.
I just want to say this too. I also think, going back to something Ziania said about the colonizers' church, and she talked, or the colonizer religion. Audre Lorde said that the master's tools will never dismantle the master's house. And so we have to start thinking about how we change our theology. And that's from the very first session we had this morning on the discussion around the gentrifiers toolbox, to think about how we have a theology that encompasses all, and that it helps us to realize that it's not about doing church as usual. because church as usual comes from the colonizer's perspective. And it gives us this framework in which we continue to push people to the margins. We continue to push things out. Thank you, liberation theology. And I think that that's where we need to be. I think that's and honestly, all of our churches are not there. And that is something that we have to understand, that when we talk about the church being a driving force and the movement that this liberation theology can have, the church resides in each of us. And so that is where you find the people that are passionate about what's happening in your community. You find the people who have liberation theology, who have a difference from a different viewpoint, a perspective, and bring them along in your movement to help to see change happen in your community.
How about you, Charles? What do you say? I see you're off the mic. What's going on?
I put on. First, I was going to say, Justin, I thought I've been watching all day. So I'm going to say you did a great job and the committee did a great job. Being on the Episcopal Urban Caucus. I'm on the board too. I thought it was fantastic. My community, I live in Waterloo, Iowa, and 2 years ago, we were the #1 city in the United States that was the worst place for blacks to live in. And we've been working very hard on that ever since that. And that was, it come out, I can't, but anyway, what was done today, I wish our community could have been here and watched this today. I know there have been a lot, I mean, I learned some things, but they really would have been learned much and everything else. But I do think also, I think we do need to invest into our youth because they're our future, but we also need for them to get education, go on, get it, if they want to go to college, 2 years, 4 years, but also get invested for the, like one person said about credit also and everything else. And I think it's a very important thing for youth because that a lot of people don't take interest in maybe their own children, maybe, but not much other than that. But like I said, in Waterloo particularly, I'll just share with you, I have a camp we started, well, me and another lady, 12 years ago, and it's called Hope Camp, but it's for children with incarcerated parents or in the county jail. It's a free camp, and we work with them during the summer. And then during the school year, we have after-school programs with them too, the ones that need help and so on, because we want to make them the best they can be. And like my two seniors graduated 2 years ago. They went to college on 4-year degree scholarships, and we just need to invest that way into them, to be with them, to help them, to understand the problems they're going through. But no, I thought today was fantastic. I'll let you know that. I mean, it was probably one of the best I've ever been. I've been on the board, committed with the Urban Caucus too. But anyway, I just wanted to share that with you. But no, I thought it was great. Fantastic.
Thank you. Fitz, I see you came off, or you came back on the video, and I see Frank just came off mute. And I saw Fitz, you said something, but I can't remember what you said in the chat.
My comment in the chat was following the woman from New York, and just a subtle, or with me it's never subtle, a reminder to those of us in Memphis that there is a certain level of access that we don't recognize, and only if you've been in San Francisco, Los Angeles, Atlanta, New York, do you understand. I can go on Facebook and DM Tammy Sawyer with a commissioner and a question mark, and she will respond to me. And we did a project a week ago where we raised $1,400 off the cuff to give $200 gift cards to teachers for professional clothing. It was just an off the cuff thing. If you are in the big cities, you do not have that access. You cannot personally interact so easily with the city council, with the county commissioners, with other authorities. And that is something not to be taken for granted, because we will do things here at potentially light speed compared to the coast. We get things accomplished here in months or a year that would take 5 years and millions of dollars in other cities. But and then to the gentleman from the board, I am not a Christian, and Florida Jackson and I, the Reverend and I, get along so well because she understands my stance on churchianity. I am a person of faith. I've been a 26-year member of the Native American Brotherhood of Churches, and we expect anyone who comes with us to pray. I don't care what God you're praying to, but doing these things as faith-based. I do go into prisons with a group called Kairos nationwide to work with fathers to help support them. There is another component that works outside the prison system with the families and the daughters and whatever, to bring people a place that they can find commonality where they are not being judged. This lack of education to prison pipeline that we live in, which is pervasive in every environment, is a big piece that everyone needs to be looking at. I understand not having scope creep and getting outside of whatever your focus is, but you have to have an understanding of how the prison industrial complex is stopping us on voting, on financial freedom, on ownership, on every level. This year, I have not had tags on my car on purpose. For 1 year, I have driven around with no tags on my car because as a fat, white, average American in a sedan, I'm not getting pulled over. But if I was black, I would be pulled over in a moment for the excuse to search my car, to run me for warrants, to do all those other things. And that simple ticket would lead, if I didn't have the money to pay for it, would lead to a warrant, would lead to going to jail, which would lead to not having a job, which would lead to not having child support paid. Boom, 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 boom. Next thing you know, a failed family. And kids in high school need to know that's how it works. They need to know about financial responsibility. So that was a very important piece. I'm glad that board member brought that up, that working within the prison system to help people reintegrate and come back out just to get the right to vote. It's a 2-year process in Tennessee, even if you've fulfilled all of your obligations. So thanks anyway for letting me go off again.
Thank you. It reminds me of some of the tickets that I've gotten. What else? What else? And listen, I'm not pulling out just, but if there's anything natural that's organic that you'd like to contribute, Ms. Hazel, I see you are still there. So I don't know if there's anything that you would like to lift.
Well, I don't mean to jump in, but I wanted to. I'm sorry, y'all. I'm moving around trying to do a few hundred things here. I want to go back to what Geraldine just said, and I really want to thank her for everything that she just said, as far as we being the church and how some of our churches are. I don't want to say the church is the way we recognize church, and how some of them are the driving force in some of the things that we're seeing. Now, one of the communities next to us just won the second part of a fight yesterday with the Land Use Control Board, and that was the attempt to put a gas station in a former location that used to be a school. Now, they were defeated 2 years ago. The community of Prospect came out, fought them off, and said no, that they didn't want that. The Land Use Control Board went along with them 10-0 last time. Completely, we're going against this. So, but this group shows back up early part of this year, and they put some wonderful signs on the site saying that that's going to be home to a new big church. It's going to be beautiful and all that kind of stuff. And, so most of us were thinking, oh, well, if it's going to be a church in that spot, I really don't have a problem with a church being there. Well, the same people that stood against it last time went and pulled the paperwork, and come to find out, the only way that the church was going to be built is if the gas station from 2 years ago was to be built. And so what this company did, they went and found a church because they know that this is a historically Black community, and they tried to slide this in using the optics of bringing a church to the community. And so, and then, during the hearing yesterday, the pastor actually spoke, and the pastor doesn't live in the community. He lives somewhere in Whitehaven, and his whole thing was, Well, I've been in Black communities for 27 years, and our church has been here in this other side for 27 years. And so we think it'll just be a good idea. Never mind the harm that they're going to bring to the community. And never mind that they're going to allow themselves as a Black church to be used to try to trick the community into accepting this project. And luckily, again, you know, it was defeated. You know, this time it was defeated 5-5. And the people that voted for it, one guy in particular who spoke from the Land Use Control Board, again, does not live in the community, has no idea of really how this intersection looks. You know, they have maps and stuff, you know, from GIS, you know, oh, well, it's not this, not realizing that right next to this site are homes. And less than a mile away from this site is the Memphis Defense Depot, which is one of the historic largest contamination sites in the country.
Yes.
So, and Geraldine, what you said is just so true, because sometimes with using the whole optics of a church, they'll stop some of the pushback because people don't want to go up against, say, a church or whatever. But like what you said, we are the church. We are speaking against this injustice. That is us. Because the fact that they went and they found a church to use to try to undermine what the neighbors went up against 2 years ago, that just shows you what little respect they actually have for the church as an institution. And so I just really wanted to give you a shout out to that. And I'm gonna put a link up to the article because MSNBC actually wrote an article about it. And it's real interesting. And they talked to, you know, my neighbor, Miss Cassandra Dixon, who led the fight. And it's just, again, you know, we have institutions parading as churches that are pushing this whole gentrification effort too, you know, because guess what? They're worried about money and their investments and looking good, but not necessarily what's good for the communities that they're moving into. So that's all I wanted to say. I'm gonna be quiet for the rest of it.
Thank you, Frank. What else? What else do we have? Top of mind.
Well, I would just like to say how I thoroughly enjoyed the forum. And as I said, Orange Mound is in the midst of redevelopment, so I received a lot of good input and a lot of things that we know that we need to avoid. I have been in contact with Pastor Norman. He came to speak to our group when we first started. So there's a lot we know that we have to go through because you don't know who your friends are. Once you start, everybody's calling, everybody's trying to get land. You think that you're doing something to the left and somebody over here, she just said, to the right. Now, when we had a problem with someone wanting to put a crematorium in our neighborhood, then that sort of solidified the neighborhood. Everybody came out. I got all the preachers in the neighborhood to come to the meetings. We went down to the land board.
They prayed on.
So we defeated that. But we have since lost our contact after COVID. We have not been able to organize. So that's what I'm trying to do now. And I know we can't go walk the community like we need to make sure that they're informed to know what's going on, because we don't want any surprises coming in on the end. So that's what we are trying to get a hold on, what our community wants and getting them involved. We do meet on Zoom, but most of our community members might not have access to the Zoom app or know how to use it. So this is giving us a lot of into community. I saw some of the other Orange Mounders on there, so I was very glad to see that we got a lot of good information to go back and work on.
Well, Ms. Hazel, I've seen you in action. I witnessed your work with the Orange Mound Centennial. Thought that was quite amazing. She put together monologues for youth to do. I was quite inspired. So I'm hoping that there were some tools that came from here, but you know, this is a reciprocal process. And so it means a lot that you were able to join in on the call. And so I'm very excited with some of the things that Ranice, you know, continues to bring from the Orange Mound space as to how we can support what's happening there.
Thanks, appreciate it.
Any lingering thoughts? All hearts and minds are clear? Okay, thank you all. This has really been beautiful. And it's been really inspiring listening to even some of the new voices that I know are on this call as well. You can, oh, ha ha ha, we have one more person that looks like she came back. I know she has something. Her name's I don't know if it's Shelia or Shelia, but I saw you signing in just now, Shelia. We were just about to close out, but you and Zianya throughout the call, there was just a lot of amazing feedback. So we were just kind of giving feedback from the day and reflections. Share. Was there, what was top of mind for you, and release it? Yeah.
Thanks, Justin. And thank you too.
Just to say real quick, I read on one of your chats that you have 4 kids and that you were going to pick up 1 kid. And the fact that you even came back to the conversation means a great deal.
Thank you so much. So 4 of my children are adults. One is a 7-year-old, and I have 6 beautiful grandchildren. So I'm really busy, but I have a strong passion, and my children and the next generation and generations even beyond that, of all of our babies in the community, because it truly takes a village. I consider all of our babies that I'm kin to. So it just pushes and drives my passion and keeps me grounded in the movement to come against these injustices and these evils in societies that are pressed upon them, that they are literally born into most times. So just a little bit about myself, other than I'm a single mom again now, and I've sat on our MATA board since 2012. Also a new board member, and let me back up, MATA being our public transit system. So, and my biggest thing is definitely my push for transit justice, because we know people don't have access to jobs, they don't have access to health care, they don't have access to healthy foods because of food deserts. So that's my whole agenda for being there for those who don't have a voice. And so I'm thankful to even have that position that God has blessed me with. I'm a new board member to Sister Reach. Our ED is Sharice Scott, and so we are advocates of for justice for women of color, reproductive justice for women of color, our teens, indigenous people, LGBTQ community. I have been in organizing and activism since 2012, Mid-South Peace and Justice Center, and being a neighborhood organizer for Whole Child Strategies, where we work with residents of Klondike and Smoky City. And you know, the list of that can go on and on, but I will wrap that all into the fact that it's all about community. It's all about relationships. I heard that being echoed so many times from so many people that I admire who were on this call, and really I admire everyone, because you showed up. We all show up for this this calling that I feel that God is calling us to transformative justice. And oh my gosh, I'm trying to think of the term that someone used earlier. What did she say? Systemic transformation. I love that. I mean, that is the key here to break down so many evils. And so I'm just blessed to be here. And I'm so grateful for all these wonderful connections. And Anassa, oh my gosh, she was, Auntie Anassa, we got to be kin. Yes, Anassa, we've got to be kin. Her new name for me is Auntie Anassa. So, so again, thank you, Justin. Thank you, all of you, for allowing me to be here in this circle. It's been amazing.
Thank you. And your passion, I think, really helps to sum up the words and feelings as to how we can go out into the world and continue to do the work. So thank you, Connie. Thank you, Charles, Geraldine. Thank you, Kathy, Brooke, Fitz, Frank, and Shelia. Is it Shelia or Shelia?
It's Sheila, but I'm
Sheila.
not too. Yes, it's Sheila.
Sheila. Okay. Thank you for your conversations. Thank you. This has been wonderful. And really just want to say have a wonderful weekend, everyone. until next time that the work is to be done. Connie, we do have a retreat that we are planning for the Spark work that's going to be coming up. And so we receive feedback. That'll be the focus for next week to get that grounded.
Oh, he's going to put me to work.
Yeah.
I signed up for it.
So to take us out and Floridia, will you take us out in prayer and in spirit, if you will, and everyone have a wonderful weekend.
Thank you.
Thank you.
It is not that we just go out with information, oh God. It is that we go out in order to do transformation that will lead to liberation. Let us move away from gentrification, but help us together to have imagination. Amen.
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 Thank you.